Pigmented Villonodular Synovitis, abbreviated PVNS, is a rare non-cancerous growth that occurs inside the joint lining, synovium. Think of the synovium as a thin, slippery blanket that lines the inside of a joint, keeping it moving smoothly. In PVNS, this blanket becomes thick, swollen, and starts to produce brownish pigmented clumps of tissue, which can make the joint feel stiff or painful. The exact cause of PVNS is not known, but doctors believe it may start from a small injury or a tiny bleed inside the joint that triggers the synovium to grow abnormally. Some researchers also look at genetic clues or abnormal cells that act like a tiny, localized tumor, even though it is not cancer. People with PVNS usually notice joint swelling that comes and goes, like a bruise that won't fully disappear. A feeling of stiffness, especially after sitting still for a while. Imagine trying to open a stiff jar. Pain that worsens with activity and eases with rest. A catching or locking sensation, as if a piece of the lining is getting stuck when the joint moves. The knee is the most common joint affected, but the ankle, hip, and shoulder can be involved too. Doctors diagnose PVNS by first listening to the story and checking the joint. Imaging tests help. An X-ray may look normal, but an MRI shows the dark pigmented tissue and helps map its size. Sometimes a small sample biopsy is taken during a tiny arthroscopic surgery to look at the tissue under a microscope. Treatment usually starts with arthroscopic surgery to remove as much of the abnormal tissue as possible. If the growth is large or comes back, a second surgery or a medication that blocks the growth signals like imatinib may be used. Physical therapy after surgery helps restore movement, just like gentle stretching after a sprain. Because the exact trigger is unknown, there is no surefire way to prevent PVNS. However, keeping joints healthy can reduce the chance of problems. Protect knees and other joints during sports with proper warm-ups and protective gear. Treat joint injuries promptly. A quick bandage and rest may limit the bleed that could start PVNS. Regular checkups if you have persistent joint swelling that does not match common arthritis, so doctors can catch it early. Recent research 2022 to 2024 focuses on targeting the molecular pathways that make the synovium grow. Drugs that block the CSF1 receptor, a molecule that tells the abnormal cells to multiply, have shown promise in small trials, shrinking the tumor-like tissue without surgery. Scientists are also using advanced MRI techniques to spot PVNS earlier and to monitor how well medicines are working.